Hi everybody. So I know I look like really bad. We'll just say that today, but it's been a hard day. So I wanted to do this video because, as most of you probably know, I have a pain pump and I got it put in October of last year. So it's not quite been a year. Um, I know some of you watched my videos on recovery from the pain pump and whatnot. So I wanted to do this video today, especially because of what happened to me this week. And because I'm very frustrated with my doctor, and I can only assume that other people have probably gone through this or may go through this. So this is for education. So in my pain pump, I get Dilaudid, which is what I took orally, and the pills worked pretty good for me. We're still, my pump, have been increasing it. First, it was like every couple weeks, then we went like every month, and now I get scheduled like every 3 months. However, I do usually call after about 30 days and say, hey, I need to come in sooner and I need to get it increased. And so they'll have a nurse call me and fit me in the schedule. So that's how that's been going. Um, I I just had to look this up. So I looked at my last increase, and um, a total 24-hour dose is 0.2726 milligram a day. So they increased it a little over 12% than before. I don't have the little remote set up yet. I was supposed to do that this month so I can give myself some boluses because I still am having a lot of pain even though it's been almost a year. Anyway, the reason for my video is that, and it's probably going to go off here in a second. 2 minutes I have. So, Sunday or Monday sometime, I started hearing this very faint, long kind of beep alert. Very soft, like long. Almost, it actually reminded me of if your cell phones get an Amber Alert, but the Amber Alerts are very, very loud. It was that sound, but it was very faint, very muffled. And I kept hearing it in the house. I mean, my kids are still here. My youngest is 12. They all have electronics. Batteries run dead. And if you're a parent, you've heard something when the batteries run dead, a watch or, a toy or whatever, they make weird beeps. That's what I thought it was. I kept hearing it just maybe once or twice a day. Kept thinking, what is that? What is that? And then I thought, like, come Tuesday or Wednesday, I thought I figured out that it was my phone, which I have there it is. Okay. I know that's not a loud, long beep, but I'll explain that in a minute. So come Tuesday or Wednesday, my mom was in town. She heard it, it would go off and I'd go, listen, you hear it? You hear it? And she'd say, yeah, I hear it. So nobody even, it never crossed my mind that it could be my pump. It didn't cross my mom's mind. None of my kids' minds. No one thought it could be the pump. So anyway, I thought it was my phone because at one point I was driving and I heard it. And my phone is always with me. It's almost always in my hand or in my pocket or whatever. Even when I'm walking around the house, it's always in the room with me, unless very rare. So I thought it was my phone. And I have the new Galaxy phone, so I'm thinking, what is wrong with this phone? It's getting hot. Something's wrong with it. The battery's messed up. I'm taking it to T-Mobile this weekend and gonna put an insurance claim in and get it fixed. So I was planning today to go up to T-Mobile and have them look at this phone because of this beeping. However, today, I woke up. I couldn't go to sleep last night. I was up all night. My back was really bothering me. My hips was really bothering me. I didn't fall asleep till like 5 or 6 this morning, and I didn't wake up until around 1 p.m. I woke up this morning. I went and got the mail. I was reading a letter I received, and I hear a different beep. This time it's a little louder, and it was just what you heard a second ago. You know, da-na-na-na-na-na. And again, I'm like, what the heck is that? My daughter was in the room with me, and I'm like, do you hear that? She's like, yeah. I'm like, something is under the bed. One of Amber's toys or something is under the bed that's turned on. I previously had like unplugged my printer in my bedroom thinking it was the printer. I thought I have a digital safe. I thought maybe it was that. But I'm like, I'm going to have to get under this bed because this beeping, this is so weird. The second time it goes off, which I thought was like 30 minutes later, something just clicks. And I think it's my pain pump. Oh my God, it's my pain pump. My daughter, who's 15, looks on YouTube at what pain pump alert sounds, and she plays it for me. And I'm like, that's it. So the long first beep was the non-critical beep. The beep that mine is doing now is a critical beep. And this was a Medtronic YouTube video, and it stated to call your doctor immediately or go into a hospital. I keep looking at my nose because I have a nose ring and you can see it and it's bothering me. Anyway, so I immediately called my after hours number for my doctor. I see Dr. Joshua Wellington. He's with the IU Pain Group. He's very highly recommended when it comes to pain pumps here in Indianapolis anyway. He's always very kind. I love his nurse practitioner. However, with all of this that happened, I am extremely disappointed and pretty upset. So anyway, I called the after hours, and the switchboard person that answered is typing stuff in, and she's like, have you had surgery within 30 days? And I said, no, it's been almost a year. And she said, well, per the notes for the doctor, if you haven't had surgery within 30 days, then we can't page them. There's no reason to. And I said, okay, well, it's a weekend and my pump is giving the critical alert. What am I supposed to do? Like, what does it mean? I will say that in the last couple of months over this summer, my pump kind of slipped up out of place. It moved a little up, and the top of it has kind of poked out a little bit. It's just kind of like crooked, I guess I could say. I talked to my doctor about it. He gave me a new binder because I said it was really, the top of it was bothering me. I've been using lidocaine patches on my skin there because I feel like it's so pressed up against the thin layer of skin that it just bothers me. To even brush up against it just doesn't feel good. And several times I've actually caught the pump on the bottom of a table, like when I've stood up, and I have really hurt myself on that. I just did it over Labor Day weekend. Was sitting at a table playing bingo and went to stand up, and it caught on that table, and I'm telling you, it dropped me to my knees and I bruised, and it was bad. My doctor said he wasn't really concerned about it. The only thing he could do was open me back up and stitch it down in place, which I'm not really into doing. But he wasn't concerned about it. Okay, last time I saw my doctor was July 23rd. That is the first time I had my pump refilled as well. So I got my pump in October, and actually I may have had it refilled in June. So I take that back. I'm sorry. I think it was 6 months. So November, December, January, February, March, April. Maybe I am really off. It was 6 months because I remember the nurse practitioner telling me, hey, anything after 6 months, the medicine might not work as good. So we refill it, even if you don't use it all. So, okay, so I'm thinking, okay, my pump and how I'm still pretty low on the scale of how often I get it or how much, I'm probably only getting it refilled, every 6 months. Like I said, I've been seeing them roughly about every 6 to 8 weeks. I know I saw them in June, and I know I saw them July 23rd was my last appointment. Now, when I went to check out, they said come back in September. When I checked out at the desk and they wanted to make the appointment, I told them I'm going to need to call you because school will be started, and my daughter, my youngest one, was going to be in middle school this year, so the hours were changing, and so I wasn't sure kind of the best times. I didn't know bus schedule or anything yet. So I told her I would call, which I did. I called on Tuesday of this week and talked to the receptionist, and how this office works is if you're not coming in for your normal appointment, which now I'm confused because this would be my normal appointment, you have to actually speak to a nurse, and the nurse has to put you in the schedule because you're kind of like an add-on. So she left a message and said the nurse will call you back and get you on the schedule. So per normal, I heard back from the office, from the nurse on Thursday. However, she called me. I was seeing another doctor, my gastroenterologist. So she left me a voicemail. Of course, she called toward the end of the day. By the time I got the voicemail and called her back, the office was closed again. That was Thursday. So Friday today, no answer, voicemail. And then this morning, or 1 o'clock this afternoon, I'm getting this alert. So, the on-call people are saying that they can't page my doctor, and they tell me that, I said, well, what am I supposed to do? They said, you need to go to the emergency room. It's a critical alarm. You need to go to the emergency room. And I'm thinking that last weekend when I hit on the table, I've damaged this pump, and I'm getting ready to get very sick with withdrawal or something. Like, I've just read horror stories and I'm just freaking out. So I immediately drive to the hospital that's near to me. It is part of the IU hospital, but it's kind of a smaller hospital. And then if you need to go to the big one, they'll transfer you. So I get there in the emergency room, and I hate emergency rooms. Anyone who is a chronic pain patient, which I have chronic pancreatitis, I have sciatica, lower back pain, sacral joint pain, sphincter of Oddi disorder. Anybody who has had long-term issues with pain and ER visits know exactly what I'm talking about. People are it's just unbelievable. I worked in the medical field before I had to go on disability because of all this. And any doctor that I worked for, never did I ever see treat how I've been treated multiple times. And if they saw me treat anyone like I've been treated before, I would have been fired. So, it's a 50-50 chance if you get a doctor that's treats you like a human. Most just went off again. It goes off every 10 minutes. Exactly. So I get there, and the lady at the front desk gets my information, and she's like, what are you being seen for today? Are you in pain? And I said, I was trying to explain to her, and she just kept cutting me off, and she's like, what's your pain number? I'm like, I'm not really here because I'm like in acute pain. It's that I'm getting a critical alert on my pain pump. I have an internal, she didn't care. She was just like, I'll just tell the nurse that somebody's out here. That was it. I'm thinking, great. I can already tell how this this visit will go. The nurse brings me back. She was very sweet. She told me she's never had a patient with a pain pump. So she didn't even know it was inside me. She was thinking, maybe, do you have an infection from the site? How often do you change it? So I was telling her some about it. She heard it go off. She went talked to the doctor. A student doctor came in first. I talked to her for a couple minutes. She gave me absolutely no feedback. And then from there, I started getting really nauseous. I had to call the button. I hit the button and asked for, something to throw up in, which they gave me. And then the doctor came in. And they had already come in and asked me for my pain doctor's phone number and stuff, so I was assuming that they called him, paged him, however they do it. So he comes in and he's like, how long has it been going off? And I told him the story about I thought it was my phone and it was a long beep, and then today it was this. And he's like, well, I talked to your doctor, and first of all, he doesn't know why you came into the emergency room. He told me that there's no reason for you to be here. We don't deal with pain pumps. There's nothing that we're going to be able to do for you here. You're going to have to, see him on Monday. And I'm thinking, okay, well, I only came here, honestly, besides the fact that I am scared to death of going through some severe withdrawals. Number one, I was told to come here, number two. And I explained it. And he's like, well, you need to let your doctor know that, because that's not what he wants to do. He was the type of person who rolls their eyes, but with their eyes closed. So I'll try to do it. I don't know if I'll be able to, because I roll full open eyes, because if I'm going to roll my eyes at you, I want you to know that I'm rolling my eyes at you. So he was just kind of like that kind of thing. So that's what he did multiple times when I was talking to him. I flat out told him that I was scared to death. I told him, I'm scared. I know that if the pump is malfunctioning, that it's not working, and the critical error means it stopped functioning. So I'm going to go through with withdrawal. And so he said that, besides the fact that my doctor said I didn't need to come to the ER and he doesn't know why I got there, and that he wasn't paged. Yeah, I know. I tried to get them to page you and they wouldn't. According to the ER doctor, my doctor just said, you know what? She's going to have to just come in on Monday, write her a prescription for clonidine to help with withdrawal symptoms and give her a couple pain pills. So the doctor's like, I'm going to write you clonidine to take twice a day. And then I'm going to give you some pain pills to get through till Monday. And I'm thinking, oh my gosh, good, because I really don't want to go through withdrawal. I have, I know somebody who went through opiate addiction and withdrawal. I saw him go through withdrawal several times. It was scary as hell. This big, strong man who did hard work every day sobbed and screamed and pounded the floor and pulled his hair, and it was very scary. It's nothing I want to feel. I have enough pain. I don't want to have anything like that. So the doctor, is also said something to the effect of, why did I not call my doctor? And that my doctor said, according to his records, my medicine in my pump was due to be empty on the 7th of September. And I guess the ER doctor, said, well, did she miss an appointment or something? And my doctor said, no, there was not an appointment scheduled. So, my doctor didn't know what had happened. Well, what happened was the nurse practitioner said, come back in September. So I called to nobody said, be in by the 7th or come in at the end of August or whatever. So I tell the doctor, the ER doctor that they just said September. And I said, so that's why I haven't been in yet. And he's like, well, it ultimately falls on the responsibility of the patient to know when your pump's going to be empty and stuff. Okay, fine. I still feel like I am a very big newbie to the pain pump world. I haven't had it a year yet, and I've only had one refill. I'm still getting my medicine increased every time I go in. So I also don't feel like there was, even though I was, explained how the pain pump worked and stuff, I was never told like, hey, this is what the alarm will sound like. Hey, if you ever hear this noise or you hear a weird beep, think that it could be your pain pump first. Like, I had no idea what to expect. And I feel like, why would they tell me if my pump was due to, be empty on the 7th? Why would they say come back in September? I feel like they would be like, you need to be in by the end of August or you're going to run out of your medicine. Because believe you me, my butt would have been in there. I would not have ever chanced it. So anyway, so the doctor walks out of my room and goes to the nurse's desk, which I was right next to. And he did shut the door, but he's like a 6'5", huge guy, loud voice. I could just see him being like the alpha type of guy. I literally hear him at the nurse's desk. I'm assuming someone asked like, oh my gosh, will she be okay? Or what about her pump or whatever? And he goes, that's exactly what you get when you sit at home all week when your pain pump alarm is going off. That's what happens. So hearing that, I've heard doctors walk out of my room and say shit before. It is so unbelievably unprofessional. It's cruel and unnecessary. I've complained. I've called and complained. I've actually written letters and sent a letter along with all of my medical records. I went to the post office and shipped like 12 or 13 huge manila envelopes out to every member at the St. Vincent Fishers Hospital Board of Directors, as well as the ER doctor that treated me. And I got a letter signed by the doctor apologizing, as well as multiple other phone calls apologizing. I kept that letter still all these years later, but still doesn't stop it from happening. It's sickening. Honestly, it's sickening. It's getting worse with how the opiate, heroin stuff is going on now. And so people can't even get their medicine, which is why I felt pushed to get into this pain pump in the first place, was because at least I talked to multiple doctors out here in Indianapolis, and I just felt like with my condition, that's not going to get better. It's going to get worse with my age and with deterioration. Nobody wants to write prescriptions every month for pain pills. I mean, they just don't. And I don't know, maybe it's my state. That could be. I'm trying to actually move to Ohio by next summer. Maybe I'll have better luck out there. I don't know. So far, I really do not like this pump. I feel like my pain is probably controlled about half that it was with the pills. And, my doctor keeps telling me to give it more time. And then this kind of stuff happens. And this is one of my biggest reasons why I didn't want the pump. Because with the pills, you have breakthrough pills. Or, we all know you might be prescribed to take 5 of something a day, but there's some days you maybe only need 3. And there's some days you may need 6. But you have a little cushion there. If I would have known what that sound was, my butt would have been sitting at the office doors when they opened the next day, making sure someone see me. There it is. So I'm sure you guys have heard it by now. That's the critical alarm. So I just want to give this, video so people know what to look for, what it sounds like, I know every doctor's different. Most of the people in the support group that I am in for pain pumps and chronic pain, their doctors still give them like 1 or 2 or 3 even pain pills to take for breakthrough pain until your pump is just working so good that you really don't have much. But they still give that so patients feel comfortable. Oh my God, I wish I had that. I really wish I had that. Some people, I don't know. My doctor, he works in a practice with one other person, and the nurse practitioner told me the other doctor does give pills at home, but my doctor doesn't like to do that because he feels like if the pump is working correctly and at the level it should be, then you shouldn't need them, which, okay, fine. But something like chronic pancreatitis is a flare condition. I can be fine for even months at a time, and then get a pancreatitis flare up and be in the hospital for 15 days. You just never know. And it's kind of the same thing with sciatica and all that kind of stuff. I mean, I just never know. My diet, I'm careful. I don't want it. I don't want the pain. I don't want to be in bed. I have children that I want to, go have lunch with at school and go to their field day and chaperone field trips and stuff. And I'm just haven't been able to do it. So it's bullcrap. Anyway, so every 10 minutes that alarm will go off until Monday. I have 12. The ER doctor, that was the other thing. So the ER doctor came back and, to my surprise, did not write me a prescription for Dilaudid, which is in my pump, but for hydrocodone's 5 milligrams, which I've been on enough pain medication to know that's like the lowest. Actually, my sister's dog, I guess, takes that for his hip and back pain. So it's a tiny little Yorkie dog. So I'm not feeling like that's going to help me very much. I'm really scared about what tomorrow's going to bring. From what I've read, when the critical alarm starts to go off when you're running empty in your pump, usually about 12 hours later is when the severe withdrawal kicks in. I've heard people saying that they have severe spasms in their legs, their muscles uncontrollable. I am so freaking scared. So I'm trying to be very careful. I think the ER doctor was a jerk. I think that he did me a disservice. He didn't take care of me, and I'm pretty upset with my own doctor, honestly, because I think that, he talked to him, and my doctor could have said, look, she's on Dilaudid, give her, I used to be on Dilaudid 8 milligrams. Right before I got my pump, we weaned down to 3 a day. Give her 2 a day or something. I don't know. I would have taken half at a time or whatever. Anything. I know what's going to happen. So I'm just, and I know that if I go to my doctor and say, you know what, I'm just over all of this and I want the dang thing out, he doesn't treat people who don't want a pump, or the goal isn't a pump. So he's going to tell me I need to find another pain doctor. And I haven't, before I decided to get the pump, I saw 2 or 3, I can't remember, 2 or 3 other pretty large pain groups out here in the Indianapolis Fishers area. And 2 of them, I know at least 2, so I think I saw 3. 2 of them told me they don't write Dilaudid oral medication at all, and suggested morphine, but I'm allergic to that. So they said basically what we would do is give you something equivalent to morphine, I think 90 milligrams, and that would be the max I could have. So they were like, the amount of the oral Dilaudid that you're on right now is like 3 times as much as we would even be able to give you. And all 3 of the offices said that. What's wrong with you? So that's why I went to the pain pump, because I thought, shit, what do I have to lose? Maybe the pain pump will be awesome and it will help my pain more, and I won't have to worry about this getting worse, over time as far as getting prescriptions. But I don't know. So I'll let you guys know, I guess, how I feel. If it gets worse, I just, I wanted to do this for education. I wanted people to hear the alarm. I was never told how it would sound. I was just told there was an alarm, but that was it. I mean, they could have at least told me, hey, go to the Medtronic website and listen to the videos. I mean, it was a Medtronic YouTube page, so I'm sure I could have figured it out. Or, maybe they should play that video for you before you have your pain pump or after you have it in and say, look, if you hear this sound, you need to call us, because I feel like most people would think that it's something laying around their house. Like, what's that noise? Is it my printer? Is it this? Is it your phone? It's just bull crap. So anyway, that's it for that. The doctor I saw, just if anyone wants to know. You see it? backwards. Dr. Chad Hemmer, Hemmer. So I will be, once I feel better next week, I'll be calling whoever the patient advocate is for IU Hospital and let them know about that. So it's great treatment, which I'm sure they'll do nothing about, and they just probably don't even tell them. So whatever. Peace and love, everyone.